This is Shah, Assistant Professor in the Department of Pharmacology, LJ Institute of Pharmacy. I welcome you all in this MOOC video lecture series, an initiative taken by LJ Institute of Pharmacy. So, today's our discussion session will be on acute renal failure and chronic renal failure. So first of all, what is acute renal failure? Acute renal failure, it is a syndrome which is characterized by rapid onset of renal dysfunction, chiefly oliguria or anuria, and there is sudden increase in metabolic waste products, that is urea and creatinine in the blood, with consequent development of uremia. So the etiology for acute renal failure, it is divided into three, that is pre-renal cause, intra-renal cause and post-renal cause. First, that is pre-renal cause. So in pre-renal cause, there is sudden decrease in blood flow to kidney, which causes renal ischemia, which causes decrease in glomerular filtration rate, which reduce perfusion to a kidney and which causes kidney injury. Then second, that is intra-renal cause, in that vascular disease of arteries or arterioles within kidney, it causes ischemia, which leads to glomerulus and tubular damage. Then post-renal cause. So in post-renal cause, there occurs obstruction to urine flow. It can be due to tumor or stone in ureter or in bladder, neck or urethra. So this is the pictorial representation of the causes, that is pre-renal cause, post-renal cause, intrinsic cause. Then the pathophysiology. So whenever there occurs any sort of injury, either it can be pre-renal injury, intra-renal injury or post-renal injury. So in intra-renal injury, it causes damage to vasculature, glomerulus, tubules or interstitium. And in post-renal injury, there occurs obstruction in urine flow system, right? And in pre-renal injury, there can be two reasons. It can cause renal artery thrombosis or it can lead to tubular interstitial inflammation, right? Both this renal artery thrombosis and tubular and interstitial inflammation, it causes decrease in GFR, that is glomerular filtration rate, which causes renal failure, right? And the post-renal cause. So post-renal cause also, it can be due to obstruction in urine flow system, which causes accumulation of urine in kidney or bladder depending on site of blockage, which causes increased pressure upstream, which causes decrease in glomerular filtration rate and which causes renal failure. Then the clinical symptoms. So first, that is the symptom of acute nephritis. It causes mild proteinuria, hematuria, edema and mild hypertension. Then syndrome accompanying tubular pathology. So first, that is oliguria phase, which lasts for about 7 to 10 days, in which there is urine output less than 400 ml per day. Then there occurs azotemia, metabolic acidosis, hyperkalemia, hypernatremia and hypervolemia. Then second, that is diuretic phase. In that there occurs onset of healing of tubules, improvement in urine output, high urea and creatinine in urine. Then third, that is phase of recovery. In that there occurs full recovery with healing of tubular epithelial cells in half of the cases or terminate in death. Then the pre-renal syndrome, where occurs renal artery obstruction. It is caused mainly due to renal artery obstruction, hypovolemia, hypotension or cardiac insufficiency. Then there occurs decrease in renal blood flow, which causes oliguria, azotemia, that is elevation in blood urea, nitrogen and creatinine, fluid retention and edema. Then the complications of acute renal failure are hyperkalemia, metabolic acidosis, which causes coma or death, then GI hemorrhage and pneumonia. Now next is chronic renal failure. So after acute renal failure, there can occur chronic renal failure if there is progression in kidney failure, right? So chronic renal failure, it is a syndrome which is characterized by progressive and irreversible deterioration of renal function due to slow destruction of renal parenchyma. Mainly the parenchyma gets destroyed and eventually terminating in death when sufficient number of nephrons have been damaged. So the main reason for chronic renal failure is acidosis, which is the major problem which leads to the development of biochemical azotemia and clinical uremia syndrome. The pathogenesis for this is disease causing glomerular pathology, that is characterized by proteinuria, hypoalbuminemia and edema. Then primary glomerular pathology, that is the major cause of chronic renal failure, is chronic glomerulonephritis. Then systemic glomerular pathology. So here the certain conditions which originate outside the renal system but induces changes in nephrons secondarily. Right? For example, systemic lupus erythematosus. It can lead to glomerular damage. Right? That is systemic glomerular pathology. Then serum sickness, nephritis and diabetic nephropathy. All this can lead to chronic renal failure. Then diseases causing tubular interstitial pathology, that is, it is damaging the tubular interstitial cells. So for that, the causes are vascular changes, vascular causes, then infectious causes, toxic causes or obstructive causes. For vascular causes, there occurs prolonged primary or secondary hypertension, which leads to nephrosclerosis, which progressive renal occlusion and which leads to ischemia and necrosis of renal tissue. Then second, that is the infectious cause, where for example, if chronic pyelonephritis occurs, which leads to progressive damage to nephrons and which leads to chronic renal failure. Then toxic causes, so high doses of drugs like NSAIDs, that is paracetamol, aspirin, diclofenac, all this, it causes chronic renal failure, right? Then lead, cadmium and uranium, it can also damage kidney. Then the obstructive causes. So chronic obstruction, which causes damage to nephron due to fluid back pressure, that is chronic renal failure, which leads to chronic renal failure, right? So examples for obstruction, it includes either stones, blood clot, tumors or enlarged prostate. The clinical features of chronic renal failure is first, that is primary or renal manifestation, then second, that is secondary or extrarenal manifestations. So in primary manifestations, there can occur metabolic acidosis, hyperkalemia, sodium and water balance, hyperuricemia, azotemia, right? And secondary or extrarenal manifestations, in that there can be due to anemia, yellow color of skin, congestive heart failure, then pulmonary edema, pulmonary congestion, stomach and duodenal ulcers, osteomalacia, that is deficiency of vitamin D. So these are the complications. Now the complications of a chronic renal failure, they are similar to that of the clinical features of chronic renal failure. So this can be the frequently asked questions. Write about acute renal failure, write about chronic renal failure, or explain the pathophysiology of acute renal failure and chronic renal failure. These are the references from which this topic is being done. Thank you for watching this video. For more such video updates, please like, share and subscribe our channel Pharma Ignite. Please press bell icon for more notifications. Thank you.